best one is rotation. The best clinical example, I guess I would see. So for instance, if I can't go to rotate to the right, I would have him rotate to the right as far as he can go. And when he gets as far as he can go, I step in. This is the muscle energy technique. I tell him to rotate into my hand without letting him move. He holds 1, 2, 3. Then he relaxes and I give him over pressure. He pushes in again. 1, 2, 3. He relaxes and I push more into it. Okay? So that's a muscle energy technique to help your, it's basically like a PNF technique. Remember kind of what we did? Like pull and relax, push and relax. So it's a muscle energy technique. If we're talking in PNF terms, not that we're using PNF here, but it is kind of like a contract relax. You contract the muscle, then you relax it. You contract the muscle, then you relax it. So probably rotation is the biggest time we see. It doesn't mean you couldn't use it in other ways. For instance, if I wanted to do flexion, if that's as far as I could go down, I could go down to flexion, then I push up, hold 1, 2, 3, let it come down further. Push up, hold 1, 2, 3, let it come down further. So you could do it in any direction. Side bend, same deal. Side bend as far as I can over, push into it. So that's just called, whenever I say demo of muscle energy technique, flexion and rotation, you can certainly do side bending as well. Again, not really on the practical, just realize I probably use that a little bit more because I'm not as comfortable kind of digging around in there and giving hard pushes on people, okay? It's a kind of a safer, you're basically mobilizing your joints with muscle energy. Again, certainly got to worry about acuity, right? Person comes in from a car accident yesterday, they probably have some muscle issues going on. Muscle energy technique might not be your first choice, right? But again, we're probably not worried about that anyway. We're probably just trying to get them less painful. So again, acuity of the injury, stage of healing, all of that's going to be, are we going to go into the, what are we going to use, okay? Let's talk about a little bit of exercise here. We'll kind of stop halfway through this then. We're going to move down to the mid and low back. We're going to talk about these. If you haven't seen them, let me know. We'll definitely do it, but I think most people are familiar with these. I'm throwing out some ideas here. Again, what's the diagnosis where we want a flexion bias? OA, DDD, spondylosis, DJD. So this is flexion bias. That's single knee to chest, SNTC, single knee to chest, double knee to chest, DKTC, just in case you're not familiar with those. All right. In a quadruped, prayer stretch, that's also called, what is that? What's a yoga term for that?
Child's pose.
So if you're familiar more with yoga and you want, so I would say more, we used to always call it the prayer stretch. I would say more folks now are probably calling it child pose. I think they're the same thing. You're basically on your knees and kind of stretching out straight forward. Especially, it says, with the posterior pelvic tilt. So if I'm on my hands and knees and I do this posterior pelvic tilt, I mean, I'm already getting a stretch here. And then if I even stretch further, it's more, okay? So prayer stretch with the posterior pelvic tilt. So those are things that if you came in, and again, we don't have to do them laying down, right? That's what we talked about. I think there was a question on one of the tests from last semester. If you have a person who is walking in the mall and they're having pain, but it goes away when they sit down, what's their diagnosis? Probably DJD, OA, DDD, because their relief position is this, which is technically flexion, versus this, which is technically extension, and certainly when we compare to this. So we understand that? So that's why you occasionally see an older person sitting in the mall and they're leaning forward. So I don't have to lay down to do double knee to chest, assuming I don't have hip replacements or other thing limiting me. I can sit and do this. This is basically double knee to chest. Or I can bring my knee to chest here. Anything that flexes me is a flexion biased exercise, okay? Any problems with those? So that's lower thoracic lumbar stretching. We got that first little series here, again, most commonly seen with disc, herniated discs. Again, we might go backwards here just a bit. Remember I said sometimes people who have herniated discs can't go in prone, right? So McKinsey would tell you start those people on a whole pile of pillows. Remember I told you I seen some guy come for like 8 pillows before, so they're flexed over 8 pillows. The whole goal is to get down to 4 pillows, or 3 pillows, or 2 pillows, and some point down to none. So that's how you progress. So instead of going prone on elbows, prone press up, you're going 4 pillow flexion, 2 pillow flexion, and that may be where you get to. When do you stop? Increase radicular pain. Don't go any further, right? Better feeling, you're at the right spot, okay? So we got something less than prone would be prone on pillows, and then prone is just laying down. Now again, a lot of times it would be, what's the best here is press up. But again, the idea is we tell a person who's had to drive 45 minutes in their car, so they've been flexion, flexion, flexion. If they stand up and do bam, they might squish the disc, right? They might impinge on the disc, so they might not feel good. So basically they go in and they lay on their stomach for 3 minutes. That kind of pushes it a little bit further in. Then they prop up on their elbows for 3 minutes. That pushes it a little further in. Then they do the press up, which is what we're really looking for. But again, we gotta kind of get there slowly, okay? So there's the prone progression. That's really kind of, again, that traditional McKenzie extension protocol. There are a lot of physicians that know that. I think I told you guys this last semester, but just so you know, I haven't seen it in a long time, but the others used to be called Williams flexion exercises. You have to see a pretty old doctor to write Williams flexion, but when they say Williams flexion, that's basically single knee to chest, double knee to chest. If you see McKenzie extension, that's the prone at elbows, press ups, okay? And then a quadruped sag, so I'm on all fours and I'm kind of sagging down in, okay? That's a relative extension if I'm on all fours and sagging in, all right? You good with that? Side bending stretch, all right? So I could be lying prone and I could just have them reach with their upper extremity, right? That's going to elongate this side, right? I could do a passive lower extremity stretch. Let's have someone hop up there. I think we might have showed this. This is almost like the quadratus lumborum stretch. Basically, it is kind of the quadratus lumborum. Go on your back, actually. That'll be just a little easier. So I'm just going to, if I'm stretching his left side, I'm just going to grab his legs here, right? Kind of bring him in this position. I probably would tell him to do that. I don't have to, but if he holds on there, that's even a little better. I'm going to be here. I'm going to use my hand as a fulcrum here, and I'm kind of doing this type of thing, right? Again, he might feel an ITB stretch. If he feels an ITB stretch, his back's not tight. It's an ITB problem. He might feel like a lat pull or something up here. If he feels that, and that's what we're going for, perfect. But that's kind of just a manual stretch. Let me make sure I don't need you for anything else. That's just like a manual stretch. Quadruped stretch, or again, child pose with lateral reach, is that kind of going in child pose and working over to one side, that stretches the right side, or working over to the other side, that stretches the left side. You're actually good. Side lying over a towel roll. So you could just literally take a pillow and lay on it, right? So if I'm trying to stretch the left side, if I'm just doing this type of thing, if I add that to it, that's gonna maybe make it a little bit more. If I drop my legs off the table, that's even gonna make it more, right? So if I'm looking to stretch the left, those are just ways to stretch side bending. So it says a towel roll, I use the pillow there. And then there's always if again, just like we did in the neck, there's always this concept of traction, right? I often try manual traction through the lower extremities, just like I do the head. Basically have them lay down, I have them grab a hold of the table. Again, we gotta watch how hard they're grabbing. If they're really grabbing, I'm not gonna get much separation. So I kinda wanna say, hey, listen, grab a hold so you don't slide, but we're not trying to get everything tense, and then I just grab their legs and give a pull. If they're a pretty big person, I sometimes put the lower extremity belt on them, like the traction belt, and then just pull through the belt, right? Especially if they've got a knee problem or a hip problem that they don't want me to pull through. Again, I give it 5 minutes, it's just a trial. Is this gonna work for you or not? Are we gonna do traction or not, right? So in that case, it's just an overall pull, okay? So we're gonna stop there. We're gonna come back next time and do lumbar down. One assignment.